This exercise series is created for you who are sitting at a desk all day long and need to exercise. Naturally, we would always recommend you to get up and walk around and have a break every 40 minutes. But if you have no area where you can exercise, this is an alternative for you. Sit with your feet hip width apart. Now I want you to do the pelvic tilt, so I'm going to move sideways. First, pull your stomach muscles in and tilt your pelvic almost as if you're slumping or slouching, and come back. And do this 3 times. Tilt your spine, curving your spine out, and come back to upright. And do this the 3rd time. Come down and in. You should be feeling your stomach muscles working to be able to create this motion. The next is to make your spine go into an arch. So we call that an anterior tilt. Tilt forward and come back. This is not recommended if you have an acute low back condition, but it's recommended when you are improving and you are progressing through your treatment with manual therapy. Again, tighten your stomach muscles in, lift your pelvic floor muscles in, and do this again. Tilt forward and come back. And one more time. Tilt forward and come back. Now I want you to go from back to forward. Slump, come to the middle and go forward. What we're doing here is creating movement in your spine and in your vertebrae, which sometimes is not happening when we have an injury, because we tend to stop using our back when we have an injury and we are in pain. Now I'm going to go forward again, and the next movement I call a hula hoop, but the hula hoop for grown-ups. So here, lift your pelvic floor muscles up, raise your stomach muscles, and very, very small movement, do a circle to the right. Hold your stomach muscles in, and what you're doing here is you're very, very gently moving the bottom vertebrae on each other in a circular motion. But you're also using your core muscles. And now brace your stomach muscles and pull your pelvic floor muscles up and go around to the left. Very, very small movements. And again, we don't want you to do big movements, and we want you to do them slow and keep holding your stomach muscles in. And relax. You should feel your muscles now. So the last one is a lateral movement. So pull your pelvic floor muscles in, brace your stomach, and go very, very minutely off to the right. The base is still and it's just the top moving. And here what you're doing is moving a little bit to the right, coming back, a little bit to the left, coming back. And do this again, to the right and come back, to the middle and to the left. And by this time you should now really feel your muscles working hard. Now I want you to bring your knee up towards your chest, and again this you can only do, and it's only advisable to do if your knees are healthy and your hips are healthy. Bring your knee up, breathe in through your nose and breathe out through your mouth, and feel the stretch in here and in your groin, and come down. Do this with the other side. Breathe in and breathe out and come down. And then again, if your knees and hips are healthy and there's no osteoarthritis in here, you can put your foot on your other knee and hold your position in this angle. Now hold your core in and lever it from your hips forward. Your spine is straight, and lean forward until you feel a stretch at the back. This exercise is usually done lying on your back, but if you're forced and you are unable to lie on your back and exercise, this will be helpful. And lean forward, feel the stretch, hold your tummy in, don't hunch and don't arch, and come down. And the same thing there. Hold your tummy in and lean forward. Hold, keep your head straight, relax your spine and lean forward and come back.